I'm Kenzie Griffin. I'm a physician assistant at Great River Women's Health, and I've been working here for about a year and a half.
My name is Laura Martin. I'm a women's health nurse practitioner, and I've been practicing in West Burlington for the past 9 years. Kenzie and I are here today to address some questions that have been brought to our attention in a recent blog post. So this is an important conversation to have with your provider. There are different restrictions or recommendations based off of your past medical history and some other medications that can sometimes interact. So it's a very important discussion to have with your provider. Some of the things that we think about as far as options are going to be shorter acting versus longer acting methods and how that impacts effectiveness. There are combined that have an estrogen and a progesterone source, some that are progesterone only, and some that are non-hormonal. Also, something to take into consideration is if you have any issues with your menstrual cycles, is sometimes that will impact the decision-making process as well. It's also something important to think about the different side effects that can come into play with the birth control methods and what you're looking for in your birth control as well. That is a great question. So the most important beginning aspect of that is trying to go into perimenopause and menopause as healthy as possible. So we know that people that don't smoke seem to have less severity with their symptoms. Also, just trying to maintain a healthy diet. We've seen that people that are in a cholesterol healthy diet tend to have less extreme hot flashes and night sweats. And also regular exercise seems to positively impact those symptoms as well. Usually the first thing we'll have you try is over-the-counter supplementation with things like black cohosh and estroven, and also trying the healthy diet and exercise. If symptoms persist beyond the 3 to 6 month period of time, there are some prescription medications we can offer for those symptoms as well. How long can perimenopause and menopause last for?
That is a good question. So menopause, once you have your final period, you are considered postmenopausal. Perimenopause is that transition leading up to the stopping of your periods where you're noticing those hot flashes, night sweats, all that fun stuff. That can last anywhere from a few years to even up to 10 years in some women, and each woman's experience is unfortunately different. Some women don't experience any symptoms, some experience really severe hot flashes and night sweats. So it is important to talk to your provider about any concerns that you're having and things that you can do to help reduce some of that severity of those. But it is truly different for each person.
How do you know when you've gone from perimenopause to postmenopause?
So menopause by definition is 12 months without a period. And unfortunately, even if you hit that 11-month mark without a period and you have one, your clock does start over. So once you've hit that 12 months without a period, you are considered postmenopausal. Everything leading up to that, in terms of your cycles changing, all of those other symptoms that we talked about, that can fall under that perimenopause umbrella.
That can be different for anybody. We are in an era now where technology has really been incorporated into healthcare and into health awareness. So some things that we can use technology-wise are apps on your phone. Flu and Flow are both free period trackers that you can download to not only track your menstrual cycles, but also your fertility as well. It can be helpful to put in information like your menstrual cycle, bleeding dates, but also physical symptoms that can change throughout the menstrual cycle. The more information you can put in, the better data you're going to get back from that. Also, a lot of smartwatches and now rings are available that can also help you by detecting different changes in your cycles and help you input data to predict those things as well. A normal menstrual cycle is going to be anywhere from about 22 to 23 days up to about 35-ish days. And a normal duration of flow is going to be less than 10 days in duration. As far as heaviness of flow, we would like you to come talk to us if you're having anything that's excessively heavy. By definition, changing a product more than once an hour during that menstrual cycle flow. And variability can differ within a few days, and that can be completely normal. But we do like to know if your cycles are coming closer than 21 days apart from each other, or if you're starting to go more than 35 days without a period.
So, like you had talked about, if your periods are coming more frequently or less frequently than what's considered normal, if they're excessively heavy, if they're painful to the point where you have to miss school, work, things like that, yes, you should come in and talk to us about that. Generally, under the age of 21, we don't start breast and pelvic exams and pap smears until you turn 21. Unless, of course, you're having an issue that needs to be addressed. So under the age of 21, kind of varies case by case. Once you turn 21, generally we do like to see you annually. Of course, that can change depending on any underlying health conditions you might have. Pregnancy, obviously, we would see you more frequently. Other things we would maybe want to see you more frequently for. Once you get into middle age, 65, 70s, things like that, we can see you sometimes every other year. Of course, that also depends on if we're prescribing you any medication, if there's any history of cancer, as well as any just general medical issues you might have. So as a summary, generally annually, but of course that it can depend either more or less frequently depending on how old you are. So infertility is 1 year of trying to get pregnant without success. If you are over the age of 35, that timeline does get cut to 6 months. So 6 months of trying to get pregnant with no success. And by trying to get pregnant, we mean actively trying, not just not preventing. So by actively trying to track your cycles, having regular timed intercourse, things like that. Infertility, unfortunately, isn't something that we can test for. It is what's called a retroactive diagnosis, meaning we can only diagnose you with it after the fact of not being able to get pregnant. There unfortunately aren't any tests that we can do right now to say that you will or won't get infertility. If I wanted to consult with a provider about infertility, what would the visit look like, or what sort of options do we offer here?
So when somebody's being evaluated for infertility, we're going to obtain a medical history from both partners to see if there is any underlying medical dysfunction or disorders that could impact fertility. Also, we're going to recommend avoiding nicotine, vaping, and alcohol intake while trying to conceive, just to optimize success rates. Also, some things to come into play are history with menstrual cycles, also testing of the male partner to make sure, is there any female versus male infertility? Unfortunately, sometimes we can't always find an answer for that, but there is some testing that we can offer here to get the process started. So some things that we do offer are lab work for hormone testing. We offer ultrasound evaluation to look for any ovarian or uterine abnormalities. We also can offer what's called an HSG, which is a test where we're assessing the tubes to make sure both sides are open. We do also offer consultation with the University of Iowa for medical evaluation of the male partner, which would be a physical exam and a semen analysis.
Do we offer IVF here?
We do not offer IVF, unfortunately. We do offer some basic medications for ovulation induction. So that is more or less to super ovulate you to try to optimize that success rate during the trying to conceive time period. So in somebody that's having regular, predictable menstrual cycles, most often hormone testing is not going to be super helpful, because we know with regular, timeable, predictable menstrual cycles, that your body's doing what it needs to do. So your hormones are also balanced in doing what they need to do. Some warning signs that you might need some testing are going to be, like we discussed earlier, a history of irregular or frequent menstrual cycles. That is a pretty good predictor of what the body's hormones are doing. So going less than 21 days between menstrual cycles, going more than 35 days between menstrual cycles, especially people that are skipping cycles multiple times a year, hormone testing can sometimes be helpful to figure out if there is an underlying endocrine disorder that could be causing this dysfunction.
Thank you for joining into our Q&A segment. If you have any questions that didn't get addressed or other concerns that you're having, please schedule an appointment in our office, as well as visit our website for more information.